Hello everyone, welcome to our channel of Arogya Niketanam Ayurveda Clinic. Today we'll discuss about a disease condition known as frozen shoulder. So this is a condition where there is pain and stiffness in the shoulder joint. So today we'll see about what this condition is, how it is happening and how it gets manifested in a patient, and which are the people who get affected with this condition, how we can diagnose this condition, and what are the treatment options we have for this condition in both allopathy and in Ayurveda. So let us move on to the topic. In our country, we know that the cases of diabetes mellitus is going on increasing, isn't it so? And along with that, we can see that the frozen shoulder cases are also increasing. It is because 20% of the population of diabetes mellitus is being affected by frozen shoulder. So the greatest risk group which affects frozen shoulder is diabetes mellitus, and the others being thyroid disorders and rarely in cases of stroke. And talking about the pathology behind this condition, the exact pathology is still unknown. But based on arthroscopic views and observations, we have come to a conclusion that it is a kind of cytokine mediated synovial inflammatory response which results in fibroblastic changes, forming some adhesions in the joint. And what happens is these adhesions which are formed in the joint will result in the manifestation of this condition of frozen shoulder. And the first stage is freezing stage. In freezing stage, what happens is that the pain in the shoulder joint will increase and it becomes worsened at the night. And the patient will be unable to sleep, or he will be waking up from sleep due to pain. And along with that, there will be increase in the stiffness also. In initial stages, the stiffness is not an actual stiffness, it could be a guarding against the pain. And this phase, the first phase of freezing stage, occurs for about 2 to 9 months. In some patients, it might occur for a duration of 2 months and then move on to the next stage. And in certain patients, it might extend for a duration of 9 months even and then move on to the next stage. So, during this stage of whether it is 2 months or 9 months, the patient will be having intense pain. Pain is the main clinical feature in the first stage. And what is the second stage? The second stage is the frozen stage. As the name suggests, the main feature in the frozen stage is stiffness. So in frozen stage, the pain will reduce and the stiffness will persist. The duration is 4 to 12 weeks. So the last stage is the thawing stage. The word thawing means reduction of stiffness. And thus the pain and the stiffness will reduce in the third stage, and the duration is about 12 to 42 months. So next we'll see about the course of this condition, which is 1 year to 3.5 years. 15% of the cases will have pain in the contralateral shoulder joint as well within the next 5 years. And we can see that in the first stage there is increase of pain. So after the first stage, the pain decreases at first. And so later on what happens is, if the patient is doing exercise, the stiffness will also decrease. And if the patient is not doing exercise, the stiffness will become permanent. That is, even though in the last stage, which is known as stage of resolution, the pain and the stiffness is set to reduce, if exercise is not done, the stiffness will remain. So it is very essential that the patient be given appropriate treatment adequately at the right time, so as to prevent the condition occurring in the contralateral shoulder joint and also to avoid permanent stiffness of the joint. Now let us move on to the clinical features of this condition. We have already discussed that the main feature is pain and stiffness, and we have discussed about the nature of pain, that is, the pain is very intense and the pain increases especially during night. And regarding the stiffness, we have to understand that due to stiffness, there is restriction of movements of the shoulder joints, and the restriction is a uniform restriction of all glenohumeral joint. A glenohumeral joint is a technical term for shoulder joint. And the diagnostic feature is that the patient is unable to externally rotate the forearm. That is the main diagnostic feature. And in case of diagnosis, we cannot rely on X-rays to diagnose this condition. So other investigation procedures like MRI or arthroscopy can be used for diagnosis. But in practical aspect, clinical features and the history of the patient and some physical examination would be enough to come to the conclusion that this is a case of frozen shoulder. And once the diagnosis is made, our primary motive is to monitor the diabetes. The diabetes should be brought under control in order to provide treatment for the condition of frozen shoulder. And in the first stage, freezing stage, the main complaint is pain. So first we'll give treatment for pain management, and it includes rest and intake of analgesics in contemporary system. And in Ayurveda also there are many herbal preparations or herbal mineral preparations which can reduce pain. Also there are some external therapies which can effectively reduce pain. That is the main treatment in the first stage. So in the first stage, that is the acute phase of pain, the treatment involves all the procedures which focuses on reducing the pain. And in the second stage, the patient is advised to do exercises in order to reduce the stiffness of the joint. Exercise is very essential for this condition because, as we have said earlier, if exercise is not done, what happens is the stiffness will become permanent. So, in order to avoid that, the patient is advised to do exercises and physiotherapy. And along with exercises, what we do is give nourishment to the joints. So here we'll give treatment with Nasya in order to give nourishment. So Nasya is a treatment procedure in Ayurveda where medication is given via the nostril. And the other treatments are Svedana and Abhyanga, where Svedana is local fomentation. It will help in reducing pain and also it will reduce the stiffness. Abhyanga is the application of oil and massage which will provide increase of circulation of the joint. And when the circulation is increased, we know that the tissues will be supplied with adequate nutrients and oxygen, which will increase nourishment to the joint. And next we'll discuss about how this Nasya is having some effect on the joint, because Nasya medications are given via the nostril, and how those medications can have effect on another joint. So the topic of Nasya is a big topic where it requires a larger descriptions, but now I'll describe about how it happens in a nutshell. So the drugs used in Nasya are having properties of relieving pain, relieving inflammation, and providing nourishment. Such drugs are used to prepare these medications which are given via the nostril. And these are given in lipid medium, either oil or ghee. And we know that a lipid substance is more amiable to the body tissues than a hydrophilic substance. So, when a Nasya medication is given, the drugs will be absorbed via the nasal mucosa. So, the drugs in the Nasya medication will enter the systemic general circulation via the nasal mucosa, because nose is the structure of the body where there is rich blood supply, and the drug entering via nasal mucosa enters the paranasal sinuses, the cavernous sinuses, and through these capillaries it enters the general circulation. And when the circulation increases, we know it gives supplies to the tissues and maintain nourishment to the tissues. And considering the blood-brain barrier, which is permeable to lipids. So as we have discussed already, the Nasya medication is usually in a lipid form of oil or ghee. And since it is in lipid media, It can easily permeate through the blood-brain barrier and give access to the myelin sheath, thereby stimulating the nerves to provide increased blood supply to the organs. So, as a result, there is nourishment to the tissues and improved functioning of organs and joints. So, this is a nutshell of about how a case of frozen shoulder can be treated in Ayurveda. There are many treatment options, both internal and external therapies, which are so vast, and it can be selected based on an individual's condition, based on a person's prakriti. In next video, we'll discuss about another topic, another disease, or another formulation or a herb. That's all for today. Thank you and have a nice day.